Good morning. Let me ask you a question that most people never think to ask. When was the last time you looked at your medications and wondered whether they could be affecting more than the condition they were prescribed to treat? For many older adults, medications can play an important role in managing health conditions and improving quality of life. They help control blood pressure, manage pain, reduce symptoms, and support overall well-being. But as we age, our bodies process medications differently. And that's why it's important to regularly review everything we're taking with a healthcare professional. Today we're going to talk about an often overlooked topic: medication awareness and brain health. This is not about creating fear or telling anyone to stop taking prescribed medications. In fact, if there's one thing I want you to remember from today's discussion, it's this: never stop or change a medication without speaking to your doctor or pharmacist first. What we are discussing today is the importance of staying informed, asking questions, and making sure your medications continue to be the right fit for your health needs. Many people are surprised to learn that some medications can have side effects that affect alertness, concentration, memory, or mental clarity in certain individuals. These effects do not happen to everyone, and they do not automatically lead to serious cognitive problems. However, understanding them can help people have better conversations with their healthcare providers. One common issue is something called medication burden. This can happen when a person takes several medications at the same time. Even when each medication is appropriate on its own, the combination may sometimes contribute to side effects such as drowsiness, confusion, dizziness, or difficulty concentrating. This is especially important for older adults because the body naturally changes with age. The liver and kidneys may process medications differently, and the brain can become more sensitive to certain substances than it was decades earlier. That is why experts often recommend regular medication reviews. During a medication review, a doctor or pharmacist examines every prescription, over-the-counter product, vitamin, and supplement a person takes. The goal is to make sure each item is still necessary, effective, and appropriate. You might be surprised by how many people continue taking medications simply because they were prescribed years ago and never reevaluated. Sometimes a medication that made perfect sense 5 years ago may no longer be the best option today. Medical knowledge changes, treatment guidelines evolve, and newer alternatives may become available. Another important topic is sleep medications and nighttime products. Many people rely on various products to help them sleep or manage occasional discomfort. While these products can be helpful in some situations, it's worth discussing long-term use with a healthcare professional, particularly if you've noticed increased grogginess, forgetfulness, or daytime fatigue. The same principle applies to medications used for allergies, digestive issues, bladder concerns, anxiety, depression, and chronic pain. These medications often provide meaningful benefits, but every medication has potential side effects. And understanding those effects is part of being an informed patient. One of the most valuable things you can do is keep an updated list of everything you take. Include prescriptions, over-the-counter medications, vitamins, herbal products, and supplements. Bring that list to every medical appointment. Doing so helps healthcare professionals identify possible interactions and ensure your treatment plan remains safe and effective. It's also helpful to pay attention to changes in how you feel. If you notice unusual fatigue, difficulty concentrating, increased forgetfulness, balance problems, or changes in mood after starting a new medication, don't ignore those changes. It doesn't necessarily mean the medication is causing the problem, but it is information your healthcare provider should know. The goal is not to become fearful of medications. The goal is to become informed. Medications save lives every day. They help millions of people stay healthy, active, and independent. But the best outcomes happen when patients and healthcare professionals work together as a team. Knowledge is one of the most powerful tools you have when it comes to protecting your health. Asking questions, understanding your treatment plan, and reviewing your medications regularly are simple habits that can make a meaningful difference over time. If you haven't had a medication review recently, consider adding it to your next healthcare appointment. It could provide valuable insights and help ensure you're receiving the greatest benefit from your current treatment plan. Remember, healthy aging isn't about avoiding every challenge. It's about staying informed, staying engaged, and making thoughtful decisions that support your overall well-being. Thank you for spending these few minutes with me today. If you found this information helpful, please like, follow, and share this video with someone who might benefit from it. And before you go, tell me in the comments, when was the last time you reviewed your medications with a doctor or pharmacist? I enjoy reading your experiences, and your story may help someone else become more proactive about their health. Until next time, take care of yourself, stay informed, and keep asking questions about your health. Those questions matter more than you think.